Hello, welcome to the Extraordinary Health Podcast with your host, Dr. Paul Bekkum, and myself, Dr. Victoria Lau. That's it for us today.
And we're done.
Yes, and
Welcome,
today we are talking about muscle pain and how that may affect you in different forms, different avenues, and different ways we can go about treating that here in the office and options for at home too. So, Dr. Bekkum, let's talk strains, sprains, trigger points. It's kind of on our top of the list of things that we see quite frequently.
Yeah. Well, most people think of muscle pain. They think of a muscle strain. They've overused the muscle, whether that be working out, whether that be doing yard work, playing golf, playing tennis, any activity that's going to kind of overload a muscle, where the muscle becomes achy, sore. That is probably the typical thing that most people would associate with muscle pain. But since that's the most common thing, we have things in the office that can help out with things like that, like laser therapy. In fact, that's the latest podcast here that was just put out by the Laser Therapy Institute. They went over how they've been studying lasers to use with athletes before they work out and after they work out. And they found that the laser for like a muscle strain, if you get it done afterwards, it's, yes, very effective. It cuts the pain down by anywhere from 40 to 60% right away because it's helping to improve the blood flow to the muscle. But as far as for muscle gains and gains in strength, they found that if the person had the laser done before they worked out, they actually had more strength gains because now all of a sudden we're getting blood flow to the muscle, so we're getting more nutrients to the muscle and all that sort of stuff so that the muscle can grow and expand and get bigger. Hopefully then long term you can see that you can perform better because you're getting a faster response to the laser being used with a muscle strain.
Well, that makes sense. Feed it good, work it out, grow it.
And if worst case scenario it gets sore from working out, you can always have laser therapy done afterwards to help decrease that pain because it's also going to help increase the nutrients that are going to the muscle there. Obviously, when you exercise or you strain your muscle, you're causing damage to the muscle. It's micro trauma, hopefully not macro trauma. If it's a more severe strain or to a point where you've actually torn the muscle there, that's a completely different story. And, there's people that have torn, it's usually more like the tendons off of the bones. Those are surgical situations there where you need to get those reattached. But muscles themselves, if you can kind of get them therapy as quickly as possible, they can heal up. Typically, I see with the laser therapy just alone, probably twice as fast as somebody who doesn't do anything at all.
Wow. So going back to strain, now we've often heard strain or sprain. Can you reiterate differences there?
Yeah, if you want to get into the semantics of
just
the words
just a
here,
little
I sprained
tidbit.
my muscle. To the average person, that might probably mean nothing to you. But in medical terminology, a strain is when you overuse or cause that trauma to a muscle or tendon. It's muscle tendon type of a word there. So think of T if you think of tendon. That's what a strain. Whereas a sprain is dealing with ligaments. So think like joints and bone and joint. Cartilaginous tissue on the edges of the bones is going to be more of the sprain injury then. So
Perfect. Yeah, so you mainly think sprain an ankle, strain a quad.
And you can have both at the same time. It's not that they're mutually exclusive because a lot of times when I see patients that have come in lately with ankle injuries, they might have a mild sprain, but they definitely strain, especially usually it tends to be their peroneal muscles or their fibular muscles, as they're kind of called now as well. And we actually need to work on the tendons and the muscles to get them to function better again because, your body's really good at protecting itself when it's injured. It literally will shut off a muscle. And that's even how we do some exams in the office here is we look for the muscles that are inhibited, the ones that your muscle or your body is protecting. It's going to shut them off so that they don't work properly. You might think, oh, everything's working just fine. Well, yeah, your body's also very good at compensating and using things in ways that they're not supposed to be used. And that's where people with chronic injuries will end up having even more chronic strain on certain muscles because they are compensating for what should be normal for a certain muscle group that's been now shut down or inhibited by your body or your brain because it still thinks it's injured. So that's what we try and look for in the office with our initial exams here is like, okay, where is the problem at? We want to get down to the root cause of the problem. I mean, you can take all the potions, lotions, pills, gels, whatever, and those are all just covering up symptoms. Those are not really dealing with the cause of the problem here. And if we really want to get things taken care of for you, we need to get down to that root cause, find out what it is, and get it resolved. So
our body is smart. It has that innate intelligence where it compensates to take care of itself. Now, looking past strain sprains, we've discussed previously trigger points. We have active, we have latent, tender. What are some things that are utilized here at the office to help with those?
I mean, some people, I've even heard some medical doctors like, I don't really believe in trigger points. Well, trigger points, there's basically two books as thick as a Bible, both of them, written by Dr. Janet Travell, who's a medical doctor, who describes how these work in your body. Trigger points are typically coming from muscles that are getting overused. They're so overused that they tend to build up kind of some adhesions in them, which then restricts the blood flow. And now all of a sudden they have what is called referred pain. A lot of patients that come into the office have things like headaches. Even could be a migraine headache, because if those muscles get tight enough, it's even going to cause some irritation even on the blood vessels there too. So, usually we have some charts in the office here. I even like to take patients, if I see what they're describing as their headache or where they have their pain, and if it looks like it's more a muscle or myofascial type pain, for me, I just start to look at the trigger points there to just see if that happens to be where it's coming from. If it is, then we can do different things like trigger point therapy and stuff like that.
So digging in, getting a little deeper and working those trigger points. So, of course, you may feel some tenderness, you may feel some pain, but we have to elicit that pain to find out what it's doing, what it's causing.
Yeah, and typically when we're doing trigger point therapy, we want to see that pain is actually referring to the area where you're complaining of the pain. That way we know that we're treating the appropriate area there. And here's the differences. There's 3 different stages of a trigger point. You have what are called active trigger points. And with an active trigger point, that's literally kind of like I was just describing. So you came in with a headache. You felt like you had this pain. It was kind of coming up and over your neck and went up and over your head. And you feel like your eyeball's getting kind of pressed out of your head. There's a trigger point that can be occurring in the upper trapezius muscle. And if I go into that muscle and I push on it and you feel like your eyeball just is going to pop out now because it's just that intense, that's what would be called an active trigger point. And then, patients that would come in to get those treated, they might come in their next visit and say, hey, you know what, I've been headache free. I haven't felt that pain or pressure behind my eye, but we still need to treat that trigger point even past that point. So we're still going to go in there, check and see if you have that spot still in that trigger point area there. We're going to press on it. And if all of a sudden you're like, my headache's coming back. Yeah, I got that pain and pressure. And in fact, I feel like my eyeball's going to pop out again. That's called a latent trigger point. And again, we still need to treat that to a point where, it might be several visits that we need to keep working on that. Usually it's not only like what's called ischemic compression, but we can do different things with different therapies in the office, and we'll get into those in a little bit here. We need to keep treating that latent trigger point. So you might come in for several visits, and then you say, hey, I haven't had any headaches. I've been feeling pretty good. We might go in, press on those same spots again, and that would and if it doesn't radiate the pain, it might be tender still to the touch. That would be called a tender point. And once we get to that spot, that's really when we're done treating the myofascial trigger points there. And I usually then look at just even the biomechanics of everything that's going on around that then. So making sure we have the proper structural alignment of the bones and joints there. So if you always want to have the proper alignment of your structural portions of your body, so that you're not putting stress out onto the functional parts of your body, which are your muscles and your tendons and your ligaments and all sort of stuff. Because if you don't have the proper structural alignment and you go and try and do some rehabilitative exercises when you have stuff out of alignment, you're just going to cause more problems. In fact, you might even make that problem worse. And that's some of the cases that we do see in the office. They've not had that taken care of. And when they come into the office here and we finally get that resolved, the pain just goes away, and it stays away because now we've gotten the proper structural alignment of things. We've got the proper range of motion and movement of everything there. And we also got the myofascial trigger points dealt with there. And then you can pretty much do any exercise or activity that you want without, aggravating it. So
Great. So you touched on just myofascial in general and adhesions. Now, what would be, looking at it, a difference, say, besides trigger point to myofascial pain? We hear IT band syndrome or plantar fasciitis. Like, what would be a difference, say, if a patient came in versus knowing a trigger point versus the myofascial pain?
I mean, usually with the myofascial pain, you're going to have local pain, and it's not going to give a referred pain like the trigger points do. You can, again, have both of those present together, but that's where we're going to start to use things like, it's called ASTIM, where we're going to use like a metal instrument. Some people think of it as, different name techniques like Graston or Factor. There's a bunch of different techniques where you'll use a metal instrument, but usually what's kind of interesting, and I always thought it was kind of bogus when I first heard about it, and they're like, you can feel things better with a metal instrument than with your hands. I'm like, yeah, right. But I was proved wrong because, you get a hold of these metal instruments and it almost amplifies where the problem is at. You'll know exactly where it's at. I use it a lot of times just to kind of locate the problem because a lot of times now we have other instruments that work much better than just using the metal instruments themselves. That can be very painful, and if you don't have somebody that's trained well in how to use them, they can be almost abusive with it, not knowing exactly what to do. I've watched some really bad YouTube videos on like some poor college dude is getting beat up by his friend who thinks he knows what he's doing and is killing him.
I think I've had some lovely Graston work done. May not have been as beneficial as it needed to be.
But using the ASTIM instruments is great. I mean, and here's where we can probably get into some of the other therapies we have in the office, because this can probably give you a better picture of how all of them can vary or differ here. By using the metal instruments to find the area that has the problem and treat the area, typically those instruments will work maybe a 1/2 inch to 3/4 of an inch deep as far as to help breaking up any kind of myofascial adhesions that are going on. And even in the past, when I've worked with this, over the probably past 20 plus years, I would let people know that we can probably get 80 to 90% of scar tissue, even stuff around very arthritic joints or very, fibrotic adhesions that people might have had from injuries or surgeries that they've had in the past. And that's kind of what the metal instruments will do. Now we have a couple other therapies that would fit into some soft tissue instruments. They're both called ShockWave therapies. The first one is a radial pressure wave, where it's kind of like ultrasound and a percussive massager added together. Now this instrument will literally go, they'll say 2 to 3 centimeters deep. So we're looking at anywhere from that 3/4 of an inch out to 1 1/4 inches deep. So it's going to get a little bit deeper than those metal instruments. It works fantastic, especially on the extremities, hands and feet. Most people from their shoulders down to their hands, even hips, thighs. I mean, you get some of that stuff there. More knees and lower legs down into the feet. And using that instrument, I would say we can probably break up, some of that scar tissue. Probably 90-95% of it is going to be gone, using that instrument. And then another instrument that we have that it's the soft tissue instrument end of the spectrum is our focused shockwave therapy, which is an electrohydraulic therapy. It basically it's going to go about 5 inches deep, so we can really get super deep with it. And the nice part about this one is it'll help even locate like those myofascial trigger points that we talked about.
Yeah.
And when patients have those going on, especially if they have in areas where they have a lot of muscle or a lot of tissue thickness, using that focused shockwave, it's about like a pencil coming out the head. I mean, you can't see it, but it's that electric shock that's coming out there. It's meant to be intense. I mean, typically when they're doing the therapy in the office here, they're going to ask the patient. It's always done to the patient's tolerance, but we do want to be running the therapy somewhere about a 4 or 5 out of 10 on the pain scale there. So it's going to be edgy, shouldn't be uncomfortable, but once we get done with it, most people will say that they have at least 50%, but I would say that the biggest comment I see is about 80 to 90% pain reduction after we run that therapy. But the other nice part about this therapy is it's actually helping stimulate the stem cells that are in your connective tissues to help remodel. So literally, we can only run this therapy like twice a week on a person, maybe 3 times, but we have to have at least a day in between to really get you the best effect. We don't want to cause any irritation. If we use it on a different part of your body, we can use it every single day. We could use it a couple of times a day if we have to, if people really have some significant injuries going on or something like that.
Mm-hmm. That shockwave, I've experienced it quite a bit myself, and how we talked about trigger points, and you press and then it refers, and oh yeah, you can do it on your back and feel it through your chest, and it's incredible what you can feel through that.
Patients that come in that have, I've had patients come in, they thought they had neuropathy going on, and after examining them, it's like, no, you don't have neuropathy going on. No, you don't have, a disc herniation or, radiating pain from something like that. You actually have a myofascial trigger point in your glute medius that's referring all the way down your leg. And when we got over it, because we can use the focus shockwave as a diagnostic instrument as well as a therapeutic instrument. And once we hit that spot and it's referring to that same area where you've had that pain and nobody else has been ever able to reproduce it or treat it to the point where it goes away, it might take a few treatments with it. I mean, depending on the severity of it, typically I would say most people are probably anywhere from 4 to 12 treatments with it, with muscle type pain. We'll just say that. Different tissues need different treatment plans and stuff like that. But if you go through that full treatment plan, you're probably going to be doing very, very well once we get done. If it's on the severe end of the spectrum where we've maybe needed to use about 12 treatments, you might need some touch-ups periodically there after that. But typically, if we did about a month's worth of care, you're still getting the therapeutic benefit for another month. If we did 2 months worth of care, now you probably have about another 2 months. So it's literally still giving that therapeutic effect for out to 4 months. If we did it for 12 visits, which usually takes roughly 3 months to kind of get done, you're having about a 6-month benefit with this. So if we get into joints, that's a whole different story. We're not talking about that here today, but typically with myofascial pain syndrome type things, people are doing excellent. I don't think we've had anybody yet that hasn't had, I would say 80+% reduction in pain symptoms. I mean, most of them are completely gone by the time we're done.
Well, that is wonderful because, we see quite a few people with myofascial pain. And like you said, maybe they come in thinking it's neuropathy, but it ends up being more of a pain syndrome. Now, how about, we talked a bit about fibromyalgia, you and I earlier, and autoimmune type cases. How would they benefit?
Me into fibromyalgia, now you're really kind of more looking at how the nerves are being affected that are connective to the muscle tissue. So it's not necessarily a muscle strain type issue. A lot of times, people, there's Fibromyalgia, I'm gonna have to say it's kind of a garbage can term because a lot of times there's no one single cause that is causing fibromyalgia in a patient. I mean, there could be multiple different things. That's where, if patients have labs done, we'll take a look at their labs to see if there's something that's off in the labs there. Because we can take standard labs like you get done in a medical office, and we can look at their averages, and most of the time people are going to come in, oh, they're in the normal range or they're in the average range. But we have some software where we look at it more from a functional medicine standpoint, and we'll look at the average range, but we're going to look at, are you in an optimal range? And a lot of times there's other ratios that we look at as well, even with, like I say, labs you've already had done. And we could literally look at those and just find out, is there something that we could be helping you with that could be diet related? Is there something we could be helping with that's nutrition related, or phytonutrients that we might need to use to help you deal with your fibromyalgia? I mean, medical wise, they just throw different nerve drugs at you to help deal with the pain. They're just covering up the symptoms. I mean, that's the big problem here, is it's not fixing anything. It's just covering up the symptoms. And there could be, multiple causes. And once we kind of have a baseline with some of this stuff here, then we can have a better idea of how to treat fibromyalgia. Getting back to some of the therapies we have in our office, again, I would probably lean more towards using the focused shockwave with some of these myofascial or fibromyalgia type patients that are having the myofascial pain, because it's actually kind of helping to put a charge on the cells. We could also use our PEMF therapy. That works really well. That's more like, you have to think of it like cellular exercise is probably the best way to think of it. It's putting a charge on your cells, so it's helping to get better blood flow out to the tissues, helping clear out things, because a lot of times, fibromyalgia patients, they could have chemicals that are actually getting bound in between that nerve and muscle that aren't allowing them to communicate really well together, and it's like the muscles are spasming and cramping all the time. So usually there's something that needs to get cleared out there that could be helpful. Foot detox baths, I think, was another big thing that I've seen help patients with fibromyalgia, because they have too many different heavy metals that are in their system, and those foot detox baths typically pull out a lot of the metals that are in your system. So.
Mm-hmm. Oh yeah, I've enjoyed the foot detox baths myself. Just a little plug here. I have Lyme disease, and I have utilized ShockWave, PEMF, and I have definitely seen quite a bit of results so far. So, Lyme Disease Awareness Month is May. So, if you have anybody send them my way. I'll chat with them.
Mm-hmm. Lyme's disease. Let's talk a little bit more about Lyme's disease. I originally came from Wisconsin.
I'm from Wisconsin.
Dr. Victoria came from Wisconsin, and it's been rampant there for, I have known of patients from back in the 1980s that had probably some of the first ones that were diagnosed with it, at least in that area. And it just seems, we don't have too many trees around us here, not too many deer either, but you get over into the Minnesota Lakes region and stuff like that, and I've had patients coming in that are getting Lyme's disease because they're getting exposed to the deer ticks over there. And, you get a lot of weird different things going on with Lyme's disease. I've had people get infections in their joints. Big thing with Lyme's disease, it can cross that blood-brain barrier. Even my oldest daughter, before we moved out here, had gotten bit by deer tick and had Lyme's disease too, and hopefully we got to it, pretty rapidly there. She got it, sent her in, got some antibiotics for it to hopefully kill off that Borrelia burgdorferi. But a lot of times there's co-infections that go along with that too, that you have to be cognizant of there. But the more you get it treated, the less symptoms you have, and pretty much can, hopefully go through the rest of your life really not having a lot of problems there. But if it's not caught right away, it could be something that, and I know some of the patients or people that I knew from way back a long time ago, they didn't get diagnosed for a long time. They had symptoms for years before they finally got diagnosed, and then had, systemic IV antibiotics done to help clear some of the stuff out, and we're in the hospital for weeks just to try and feel like a human being.
Oh yeah, I remember those days.
So
3 years about being bedridden quite a bit. I wouldn't go back to that. I'll continue pushing forwards. I'll continue with the therapies here.
yeah.
So moving past, we can talk more on Lyme another time, but just looking at, simple things. We touched base a bit on supplements and things like that, but we're running short on time. So how about a quick few at-home remedies?
I mean, for muscle pain, a lot of times, if you don't have a lot of swelling going on, if it's been an acute injury, you just, had it happen, typically within the first day to 3 days, you're going to want to probably put some ice on it just to keep the swelling down so it doesn't get too bad for you there. I would almost encourage people to do more a contrast bath with it there, and you can do that as frequent as just putting some cold on for a minute and then putting something on that's kind of, I would say, room temperature. You don't need to go hot with it there for a minute and go back and forth with it there so that you can get blood pumping through that tissue there to help your body heal it up, get it, all the tissue that has been damaged circulated out of the area there so you can kind of get that muscle strain kind of functioning better again as quickly as possible. Once you get past that third day, then you can start just experimenting, with just using some heat on it then at that point. But obviously, we always tell people that you should get in as soon as possible just to get it evaluated, because if it's bad enough, hey, you want to get some things done right now. If you have damage to a muscle, you don't realize maybe how bad it might be, because like if you have your skin, you get a big cut on your skin or something like that, and you see that, oh my goodness, there's a big gaping wound here, you're going to go in and get that stitched up so you get a nice fine line scar there, right? Well, you could have torn the muscle really bad. If you don't get in to get it treated right away, it's going to fill in. That's where you get into the myofascial pain syndrome type stuff here, because your body's going to repair it, but it's a matter of, do you have a positive protein balance or not? If you do, your body's going to probably lay down more muscle tissue again. There's still going to be some fibrous tissue there because it does need to knit all that stuff together. That's going to get put together. It's just like a spider web going out there. And some of that, some people's bodies, that's where it goes a little haywire sometimes too. And that scar tissue starts to spread out all over their whole entire body. And that's where you end up having more systemic type things like fibromyalgia. But the sooner you can get in to get it evaluated here, you don't need to be going old school and just rub dirt on it and keep going. I just encourage wherever you go, just go in, get it checked out, get something done to just make sure that you don't have something that's a little more significant that could have gotten treated, that could have gotten better because you got treatment right away with it. And typically what I see with people, it's going to shorten your recovery time by half if you come in and get it treated, if it's significant enough to need treatment. So, and even if it's a minor thing, a lot of times, hey, if we get it taken care of right away, now the risk of having some scar tissue that's in there that lasts for a long period of time is just minimized significantly. So
beautiful.
So other home remedies, you get into, like we have, I think Allie will put a link out here. I think I had more like a muscle recovery formula. I think generally it's thought of to be, more related to like training and stuff like that. But even if you've had an injury, that can be, the same situation here. Getting enough protein in your body there to help recover is key there. So,
right. So there's definitely things that you can do at home. Touch base, ice, heat, other things that multiple people have used, and we do have them in office. So if you would like a sampler to try it out, rock tape, rock sauce, vibration or Theraguns, those have been very helpful, especially with those trigger points. I know I for one really enjoy cupping. That's been beneficial in my healing process. But yeah, lots
kind
of
of
things.
Cupping's kind of the reverse of some of the other therapies there. They're more compressive therapies, whereas cupping is kind of decompressive. So it's opening everything up so you can get better blood flow through there. That's where you see like Michael Phelps and all that kind of thing in the past there. Swimmers like it, and it just is kind of spread from there since they had that on the Olympics and all that. But Definitely a helpful therapy there. I think just making sure that you're going into somebody who, even has access to a lot of these things, or can refer you out to get some of these things done so that you can recover as fast as possible. Because in our office, hey, we want you to finally feel good and live your full potential. And if you have a muscle strain that's holding you back, like I say, just come in, maybe get it checked out, or go wherever you're going to go. Just get it checked out to make sure that's something that's not going to cause you long-term problems. Because if you just ignore it, it's not going to go away. And the sooner you deal with something, the less stress you have, even just mentally on your mind, even physically, because of now you've gotten that injury healed up properly in a very short period of time, probably compared to what it would take if you didn't do anything about it. So,
Oh, yeah, that pain can play tricks on the body and brain. So make sure to get evaluated, whether it be at our office or whoever you work with. We can check things out, and we'll let you know what we can do or what we can't do, and send you where you need to go too if we have somebody else in mind. So that is today. We talked about muscle pain. Follow us along at the Extraordinary Health Podcast, and Dr. Paul Bekkum and Dr. Victoria Lau. We are signing out.
have a good day.